share my screen and different hernia procedures, and I would like the participants, the audience, to participate in it by commenting in the chat box. It's a sort
of hand raise.
Or by hand raise. So it's a sort of surprise quiz.
Hand raise is the best procedure, right?
So these are different procedures for inguinal hernia repair. Number one, this picture is showing that an open herniorrhaphy in which posteriorly the transverse fascia has been opened. Now there are multiple interrupted non-absorbable sutures between the transverse fascia conjoint tendon to the inguinal ligament. So, and it starts at the periosteum of the pubic tubercles. You just have to name this procedure. Okay, Dr. Haris.
Haris has raised his hand.
Yes, you can unmute Dr. Haris.
Sir, it's shoulder ice repair.
That's just a single layer repair done. Interrupted sutures between transversalis along with the conjoint to the inguinal ligament. So it's the Bassini repair. Shoulder ice would be more of a layered repair. Okay,
no, in this you open the
Haris,
transversalis fascia.
What made you confused about multiple? Okay, Haris, what made you confused was opening up the transversalis fascia number one, and you saw multiple sutures. So multiple suture doesn't mean it is a shoulder ice repair. Multiple layers basically is the basic hallmark of shoulder ice repair.
Okay, sir. Okay.
Right, sir. Okay. Now this is a sort of same repair, but in this, a releasing incision has been placed on the rectus muscle. So we have added a releasing incision. So what is the name? Yes, Dr. Zulfikar. Dr. Israr.
Desarda.
I'm sorry, that's also wrong.
Can you repeat the question, please?
It's the same repair, the stitches between the conjoint and the inguinal ligament, and only there is a releasing incision in the rectus muscle.
The one we do in the femoral hernia and one for inguinal in case of Desarda.
You can see this releasing incision over the rectus muscle.
Yes, so in case of Desarda, we give incision in the rectus muscle, and there is a two-strip of muscle.
Okay, so I'm afraid.
In Desarda, we give incision to the external oblique.
Right, you're right, Sharia. Okay, so this one is the Tanner's repair. It's just the Bassini combined with this release of the rectus. Okay, moving on to the next one.
Okay, participants, hello. I was telling you that in the beginning that you should mention, you are supposed to learn, you are supposed to convey, you are supposed to communicate internationally acceptable procedures. So Rathore, Desarda and Abdul Hafiz procedures and all these things, they are out of fashion, right? Don't mention your exam, right?
I'm just going through these because these are very confusing and it's a part of history, so we should theoretically know them. So I thought it would be a good idea. So the next one is, it's a procedure in which the external oblique has been used to strengthen the posterior wall. And as you can see, the cord is lying in the subcutaneous position. It's just beneath the skin. So name it.
Desarda.
No.
No, Desarda.
Okay, Dr. Haris. Dr. Zulfikar. You can also comment here in the chat box. Or Dr. Bali. I'll just name it. It's the Halsted repair. In the Halsted repair, the spermatic-corded lies just beneath the subcutaneous plane.
Again, it's an absolute one.
Yes, exactly. So next one, this is a type of repair in which we have strengthened the posterior wall by opposing the transversalis fascia to the Cooper's ligament. And it is continued until the inguinal ligament.
Make AVD.
You are close enough, but no. Yes, Dr. Neelma has said it right, and Dr. Bali as well. McVay repair. McVay repair can be used for both the femoral hernias as well as inguinal hernias. Okay, this is a procedure, the Scholdice repair. Anyone would like to explain that, the layers, the 4 layers of the Scholdice repair? Okay, due to shortage of time, I'll just say it out loud. So number 1, you can see that the transversalis fascia has been opened. Now the first layer is between the transversalis fascia lower flap to the posterior part of the upper flap. So the lower flap is sutured to the upper part of the posterior flap. Then this upper flap is sutured to the base of the inguinal ligament, or to the lower part. And then it's a sort of double breasting. Then in the next step, you suture the conjoint tendon to the inguinal ligament. And then the anterior rectus sheath and the medial and posterior aspect of the external oblique. Anterior rectus sheath with the medial aspect of the external oblique medially, rectus sheath medially, and the external oblique laterally. So these are the 4 layers. And on top of it, you close the external oblique on top of the spermatic cord. So the Scholdice repair, the 4 layers of repair. I hope it's clear. Again, these are the layers of the Scholdice repair. The first layer being the transversalis fascia lower flap to the posterior part of the upper flap. Then layer 2 is upper flap to the base of the lower edge plus the inguinal ligament. And layer 3 is the conjoint tendon to the inguinal ligament. Layer 4 is the anterior rectus sheath medially to the external oblique aponeurosis laterally. On top of it, you close the external oblique continuously. Now,
Done repair.
Exactly, Dan's repair. So the sutures are between the conjoint tendon and the inguinal ligament, and now you can differentiate between the Dan's repair. Next is just medial to the spot structure in the transversalis fascia. A few sutures.
Little repair.
Exactly.
Little repair.
Yes, you are correct. Little's repair. And Dr. Solmaz has also said it correctly.
It doesn't spell like that, okay?
Yes, it is LYT.
LY, yes, sir.
LYT. Okay, Desarda's repair. Okay, the name is
LYT.
So now you can see the difference between the Desarda's repair, as there is a releasing incision, as Shahryar correctly mentioned, that this flap is created of the external oblique. Here an incision is placed and the flap is created, and then one part of this external oblique, it is stitched to the internal oblique muscle above, and below it is stitched to the inguinal ligament. So that strengthens the posterior layer. Okay. Next one Here, it's an open type of repair in which we have reached the pre-peritoneal space. The sac has been separated, and then a huge mesh is placed. What is this called? This is the final. A single mesh has been placed from the groin area up to the mid-umbilicus. Stopa's. Dr. Sheriar is right. It is Stopa's repair. The other name of Stopa repair would be? Anyone? GPRBS, Dr. Waliur Rahman. Can you say that out loud? What does that mean? Yes. Giant prosthetic reinforcement of the visceral sac. Right. Okay, next is another type of, now this is a type of mesh repair in which the mesh has been placed in the pre-peritoneal space. As you can see in this, the last figure, the C part, the position of the mesh.
We cannot see the pictures.
Just in repair.
No, in Lichtenstein repair, you don't place it in the pre-peritoneal space. It's an anterior type of repair. This one is a posterior type of repair. The name of Reeves mesh repair?
No.
Okay, so, sir? All right, so I'll just go through the last few slides. This was Reeves repair, mesh type of repair, posterior approach. Okay, these are pieces of plugs. These were also used but not widely practiced nowadays. A flat mesh type of repair, placing a flat mesh to strengthen the posterior wall. What is this? This is a Proline hernia system. It has two meshes, an anterior one and a posterior one, so both types of repairs were done. And our standard Lichtenstein tension-free mesh repair. That's the last picture. It's showing 3 incisions. Basically, these are for femoral hernias. The low approach or the Lockwood approach is when we just have the hernia, it's not strangulated and it can be approached through the groin area. The second one, the trans-inguinal approach of lothicine, that is an inguinal approach. And high McFD approach is commonly practiced when there is evidence of strangulation. So the approaches of femoral hernia. So well done, you all did well. Thank you. Thank you, sir.